The aims of this session are predominantly going to be focusing on diet, nutrition and weight loss. We're going to be talking about assistive devices and footwear, and also some complementary therapies which might be helpful. We will also be addressing some aspects of cycling technique at the end of the session. So on to nutrition and diet. This area is a very contentious area, it's very broad. However, we do believe that excessive weight can put potentially more force and pressure through the joints, particularly of the lower limb, but also being overweight can affect systemically how bodies work, which may cause more systemic inflammation and cause more problems associated with osteoarthritis. It's really important that we have a balanced diet that combines different types of food intake for our health. If we can, reducing cholesterol is beneficial. People with osteoarthritis are more likely to have high blood cholesterol. And it's also important to recognise that diet and nutrition will have an effect on systemic inflammation, as I mentioned earlier, and eating enough antioxidants, which include vitamins A, C and E, may help prevent further joint changes associated with osteoarthritis. The NICE guidelines for weight loss include a balanced diet, which essentially needs to be combined with exercise. It's important that you lose the weight, if you need to lose weight, steadily, no more than 0.5 or a kilogram per week. People with certain medical conditions such as type 2 diabetes, heart failure or uncontrolled hypertension or angina should check with their GP or healthcare professional before starting a weight loss program. There are examples of weight loss programs on the NHS, on the internet. You can have a look at the NHS website, and they provide some really useful guidelines and assistance with regards to weight loss. What I'm going to talk about now is glucosamine sulfate. Glucosamine sulfate has been used for some time as a supplement to help the cartilage structure, and in some cases it's used to alleviate symptoms. NICE guidelines report limited evidence for the use of glucosamine and do not recommend it as a treatment. However, anecdotal evidence suggests that there are groups of people that it does work for, and there's a very low risk profile of it, so it may be worth giving it a go. Essentially, the glucosamine comes from shellfish, animal bones, bone marrow and fungi, and it's important to take about 1,500 milligrams per day if you're going to take it. Chondroitin is another dietary supplement. It's found in the body but can decrease with age or presence of osteoarthritis. It's usually sold with glucosamine, and again there's very limited evidence to show that it's useful for the population studies, but there is some anecdotal studies again that suggest that it may be helpful, but it's not captured within the research. Again, that's represented in the NICE guidelines, as they don't recommend the use of taking chondroitin as a core treatment for osteoarthritis. Cod liver, oil, cider vinegar and other food supplements have been, again, anecdotally suggestive of reducing pain associated with osteoarthritis. Large-scale studies haven't really shown that it's been that effective. However, again, because these supplements have a low risk profile, it's very reasonable to take them, and if they work for you, then that seems absolutely fine. NICE guidelines do recommend the use of assisted devices to help improve people's mobility, balance, and be able to engage with certain types of activities. Examples of assisted devices include walking sticks, long-handled reachers, sock aids, which reduce the need for bending, bath and chair aids, bed raises, raised toilet seats and additional handrails. These home adaptations can improve your mobility and your access in doing meaningful activities. NICE guidelines also recommend the use of supportive footwear. Supportive footwear have a good soft, thick cushioned sole which help reduce the shock when walking or running. It's important to check your footwear appropriately for signs of wear, and have a look at your footwear at least once a year and potentially buying a new pair of shoes. Braces and joints supports can also be considered with people who have biomechanical joint pain or instability. The use of Nordic walking has become increasingly popular, and this is because the use of Nordic walking poles can reduce the load going through our lower limb between about 30 to 60%. It's a whole body exercise, and many people enjoy getting out and about in a much more comfortable way. These Nordic poles are relatively cheap, costing approximately £30, and they're nice and lightweight, and they can also be telescopically used for ease of transport. Let's hear from one of our past participants.
The question and answer was very good, and there were certain things that you may have felt a little foolish asking, but when there's a group of people, sometimes of a similar age, once they started to ask the questions, then you became more confident and about the diet and the importance of keeping up the exercise and losing weight, of course. I don't just feel like a passive patient. You go to the doctor or you go to the hospital and you have procedures done or you're given drugs. I'm now able to contribute to managing my condition, and it feels pretty good. Yeah, you feel your sense of well-being. You know, you feel more in control.
Okay, so this week when you're spinning, you want to concentrate on your hip, knee and ankle alignment. So as you can see here with Erica, she's pushing her heel down towards the floor. There's a nice even pace, and she's got a nice line that goes through her hip, her knee and her ankle. What you want to try and avoid is that your knees knock in towards one another or they flare out towards the sides of the room. Obviously, if you have any problems with your knees, you may need to adjust your technique or your positioning slightly, but where possible, try and think about having your hip, your knee and your ankle in alignment straight down towards the floor.
So to summarise week 4, we've talked about diet, nutrition and weight management, and simply doing this in conjunction with exercise can very much help manage the symptoms associated with osteoarthritis. We've talked about assisted devices and correct footwear to improve our mobility and access to do meaningful activities. We've also talked about complementary therapies, which may be helpful for the management of your particular symptoms, but we cannot generalise that to a population. And we've also mentioned cycling technique with a focus of alignment at the hip, knee and ankle.